COVID is back, or should I say, remains in the news. Now, I know there's been so many big news stories that deserve our attention, from Russia's invasion of the Ukraine to the horrific racist execution of 10 African Americans in Buffalo. But there's another story that also deserves our attention, and that's the rising number of COVID infections and hospitalizations. After more than two-thirds of the staff that works on the special report tested positive for COVID, we decided it was time yet again to put COVID back in the news on the special report, and time for us to talk to the experts. And today we're taking your questions as we get the latest on COVID-19, all coming up next.
Live from Los Angeles, this is the Special Report with Areva Martin.
After months of declining numbers, California, New York, and states big and small across this country have recorded up to 20 to 30% increases in coronavirus cases over the last several weeks, along with smaller but still rises in hospitalizations, causing some health officials to suspect that the country is headed into a new pandemic wave. The increase coincides with the loosening of COVID-19 restrictions such as mask mandates and vaccine verification rules, as well as the rise of new subvariants of the highly transmissible Omicron strain. Top Biden administration officials warned just yesterday that 1/3 of Americans live in communities experiencing rising levels of coronavirus cases, and hospitalizations are also seeing an increase in cases. Biden administration officials urge individuals, each of us, to resume taking personal protection measures, including wearing masks. The question now is how much higher cases will go and whether new government intervention will be needed, or are we all just on our own? Joining me, our first guest this morning is Dr. Amish Adalja. He is a senior scholar at Johns Hopkins Center for Health Security, and he's a returning guest that we've looked to throughout the last year or so as we've tried to make sense of COVID-19. Good morning and welcome back, Dr. Adalja.
Thanks for having me.
So you heard in my introduction, 2/3 of our production team, including me, tested positive over the last several weeks or months for COVID. And we're wondering, as we are experiencing our own issues with COVID and reading these headlines about the rising cases, what's going on?
What's going on is a couple of things. Number one, we have more contagious variants, ones that are able to get around some of the immunity that vaccines provide us, some of the immunity that prior infection provides us. And then you have people that are back to their pre-pandemic life for the most part, interacting with people, not wearing masks as much, doing indoor activities. So those two things together are causing this rise in cases, which is totally to be expected with the virus that hasn't gone anywhere, that's going to continue to infect us and become endemic. So the key thing is to think about the caliber of those cases. Are they ones that are putting hospitals underwater again? And in general, no, we're in a good situation when it comes to hospitals, even though hospitalization numbers are up from what they were several months ago.
So I hear what you're saying. So it sounds like you're not overly concerned. And do you think the Biden administration is worrying needlessly about these rising cases, since you said they're not putting hospitals underwater?
I think you have to think about it two different ways. We're always going to have cases. There's going to be ebbs and flows and hotspots in increased variant activity that causes people to get reinfected. But our goal with the virus like this is to drive its spectrum of illness, or how severe the illness is, to the mild side, so that we don't see hospitals worrying about staff or personal protective equipment or ICU beds again. And increasingly, I think it's becoming harder and harder for the virus to do that, but there's still going to be cases. And with a variant like Omicron and our current vaccines, there's going to be cases, just because the vaccine does not provide very strong protection over time against infection. And I think we do need to develop better countermeasures, better vaccines. We need people to get Paxlovid. We need people to get monoclonal antibodies, and we have to come up with kind of a sustainable approach to this virus. But I think people somehow think of this pandemic or these cases like a hurricane, that they're eventually going to just disappear one day. That's never going to be the case. There's always going to be a baseline number of cases, hospitalizations, and even deaths. but at a much more manageable level. And people do need to learn how to risk calculate. And I think that was stunted throughout this pandemic.
Okay, help us understand what you mean by that when you say risk calculate, and then you said that was stunted.
So risk calculation means that when people go out and about and do their activities, that they realize that COVID-19 is always going to be some risk, that it's non-zero. It can't be eradicated or eliminated. So when they go out and socially interact, they can think about, is this some activity I want to do? Do I need to take any other precautions? Am I high risk? Should I be wearing a mask? Should I be doing this outdoors versus indoors? Do I have a plan for Paxlovid or monoclonal antibodies if I get infected and I'm one of the candidates for that? Are my vaccines up to date? All of that is how you risk calculate. But during the pandemic, a lot of activities were kind of you were told not to do those activities. It was kind of an abstinence only approach. So that didn't allow people to understand how to navigate a world in which COVID-19 is an ever-present risk, and a risk that's not going to go away. So that's an opportunity, I think, that was missed early on, and now people are having to do it sort of on the fly.
Well, what we experienced, those of us at the special report who tested positive at some point, going out into crowds with whether it was concerts or restaurants or movie theaters or department stores, and basically nobody was wearing a mask. And as you know, those vaccine verification requirements that we saw at the end of last year were pretty much dropped. So when we rolled into March or April of 2022, everything just seemed to instantly go away. No masks, no vaccine verifications. And people, I live in Los Angeles, and I don't see people doing anything that looks like mitigation. So abstinence, March of 2020, everybody's locked down, stay in the house. March of 2022, 2 years later, everybody's out with no precautions.
So I think that's a normal transition, because in March of 2020, we didn't have vaccines, we didn't have antivirals, we didn't have monoclonal antibodies, we didn't have home tests. In March of 2022, or now in May of 2022, we have so many more tools that we did that you can't think that the same paradigm should apply. That we've advanced a lot in our ability to manage this illness, even though it's still there. And I think it's also important to remember that when you see people, if you're not comfortable with how people are acting, one-way masking works. And now the general public has access to N95 or N95 equivalent masks, which work. So I think people individually are going to have to decide what level of risk is tolerable to them. How much are they going to try to avoid a virus that really is ubiquitous, and all of us are going to get at some point, and probably get multiple times in our lifetimes, just like other coronaviruses. And that's the kind of messaging I think we need to have, so that people really know what the trajectory of this pandemic is and how it's going to transition to an endemic respiratory virus.
But I think, Doctor, many of us feel like we are just being jerked around. So we started this public health crisis with this focus on this being a public health crisis, and public health doctors and professionals were helping guide us through this. And now we feel like, and Biden's administration is telling us, hey, you're on your own. We encourage you individually to do this, but we're not going to mandate that you do it. But it hasn't changed. It's still a public health crisis, but it feels like we're individually on our own. And when I was myself tested positive, I'm talking to a doctor. I says, well, what about contact tracing? Am I supposed to call anybody or do anything? And the doctor basically said, hey, it's every man's for themselves. People know when they go out that they may be exposed to COVID. He says contract testing or tracing pretty much fell by the wayside, and that it wasn't happening. So he didn't impose on me any obligation. Now, I did contact people that I had been around, but quite frankly, I'd been around a lot of people because I'd been to a conference, I'd been to a concert. So it was impossible for me to know all the people that I had come into contact with.
So a couple of things. The public health emergency and the public health mitigation measures were tied to flattening the curve. And if you remember that curve from a long time ago, there was a dark line across it. That was hospital capacity. So in the United States, all of our public health mitigation was not geared towards reducing cases to zero or reducing cases so much, but reducing hospitalizations and hospital capacity concerns. And once that's been achieved, I think we're in a different place. And contact tracing was important in the early days of the pandemic. We were never able to do it great, but it did have a role. But with Omicron, the incubation period has shrunk. It used to be, 7 days or so for most people to get ill. The incubation period of the Omicron variant is much shorter, meaning that you cannot keep up if you're trying to contact trace. So most public health agencies are not contact tracing unless there's an outbreak that has special characteristics. Maybe it happened at a conference or a certain special event. So in general, you should still notify people that you were positive so that they can get tested and keep on the alert for symptoms. But we're in a different realm with this pandemic, even though the virus is still there and it's spreading. And that's because we've, for the most part, delinked cases from hospitals in crisis. And I do think that the CDC's recommendations are important. And I think the CDC works much better when they're issuing recommendations versus mandates. The CDC issues recommendations for lots of different infectious diseases. And now they're moving to that paradigm for COVID-19. And just remember that just because something is not government mandated doesn't mean you can't do it. And I think the mandates have really gotten people to be very rebellious about it, to not comply just on the point of not wanting to comply with the mandate. So I think the CDC works much better when they're issuing recommendations and people are doing things voluntarily.
Well, okay, I don't know if I agree with you on that, because when there was verification for vaccines in restaurants and different public sporting events, people did show up with their verification. So whether it was government mandated or private corporations mandated it, we did see some level of compliance. If people wanted to go to this restaurant, it wasn't like the restaurants were empty. People showed up with masks and with vaccine cards. Now that doesn't happen, and people, at least where I live in the city of Los Angeles, 11 million people in the county, there doesn't appear to be much mitigation happening at all. So I would just ask you, what is it that you see people doing now that you would advise against, and what do you think people should be doing?
I think people should be getting acclimatized to the fact that they cannot get the COVID risk to zero, that there's always going to be some level of transmission when you have social interaction. And when it comes to the vaccine requirements that you mentioned, I think Omicron has kind of changed the equation, because Omicron is an immune evasive variant. And even if you're up to date, suppose you've gotten three shots, 4 shots, 2 weeks later, you're basically susceptible again to Omicron. So those vaccine requirements, to having an event vaccine only, made a lot of sense in the early days, even up to Delta. But Omicron, I think, diminished the value of having things being vaccinated only, because that's not a guarantee that you're not going to get spread.
Well, let me ask you this. The vaccines that we all got, or many of us got in early 2021, are those vaccines even still working as it relates to Omicron? Because it sounds like you're saying Omicron is so different than Delta that we need a new vaccine for Omicron.
The vaccines are working against what matters, and what matters is prevention of serious illness, hospitalization, and death. But they aren't able to stop transmission the way they could with Delta or Alpha or the original version of the virus. And I think we do need updated vaccines, and both Pfizer and Moderna are looking to update the vaccine, maybe for the fall, to put Omicron in it, because our vaccines are not doing that same type of transmission blocking, but they are critical when it comes to keeping people out of the hospital and keeping people from dying.
So if you had the Omicron variant of COVID, obviously you can get it again. I mean, you can get it any number of times. Is that what you're saying too?
Not in the immediate period. Once you've recovered from Omicron, you probably have a several-month period where you're not likely to be infected. But several months down the line, yes, you can get reinfected. And remember, this virus comes from a family of virus that causes 30% of our common colds. And those coronaviruses reinfect us almost yearly. So that's where we're going with this. And I think so long as the reinfections are not severe, that's a win.
So I know there's a new home test out. There's a third version, or the government is sending out home tests now, and people can go to the government website to request a home test. Because you're saying the virus is becoming so similar to those common colds and viruses that we were getting before COVID, should you test yourself every time you get a common cold symptom, like a cough or a sore throat, or you're feeling congested? Are those the kinds of symptoms that you should automatically say, I better, do a home test?
I think that's a good practice, to have a low threshold to test, especially if you're somebody that's above 65 or has a high risk condition, because then you might qualify to get Paxlovid or a monoclonal antibody. So we want people to be tested rapidly so that we can link them to treatment. And I think it's also good to know your status, because if you're positive, you probably shouldn't be out, or you shouldn't be out around other people. You should be isolating. You should tell some people that you're positive. So I think a low threshold for testing for COVID is a good thing. I think the home tests have been really great. I would like to see these home tests expand to influenza and other respiratory viruses as well.
So again, I said free. You can get these tests now free at covid.gov. The antiviral medication that we've been talking about, you've mentioned several times. So again, some confusion about who gets it and how you get it. when I contacted my doctor after I tested positive trying to go into a meeting, my doctor says, you don't qualify for it. And then I called another doctor because I wasn't going to just, I'm not going to stop at that first doctor. I actually ended up talking to like 3 or 4 doctors. And they all said no. And then one of my doctors said, not only I don't recommend it, you probably couldn't even get it. That most pharmacists in LA County don't even have it. That it's selectively given to certain pharmacists because of some contractual arrangement with the manufacturers. And that was disheartening to me. So what are the standards by which, who's qualified for this medication? Because at first when it came out, it was like, anyone, you get COVID, call your doctor, get to a pharmacist and get your antiviral medication.
So the scarcity is not a problem anymore. This is ubiquitous. It's sitting on pharmacy shelves all over the country. So that's not true. But it is true that the benefit of this drug is really been shown only in people that are high risk. So people that are above the age of 65, people that have high risk conditions like diabetes, asthma, obesity, being overweight, cardiovascular disease. That's where the benefit is. And those are the people we want to give this to because it prevents them from needing hospitalization and from dying. So we are targeting it towards high risk populations, not because we don't want to waste it, just because that's where the benefit was shown. So if you're very low risk for hospitalization, the drug isn't going to really change your risk for hospitalization. But if you're high risk, it can be life-saving.
And we know, and so another thing my doctor told me and some of the other staff members was not to test yourself after your 5-day kind of quarantine period because the virus can remain in your system. Is that still kind of the prevailing norm with respect to Omicron, or is that true when it was Delta?
This is sort of a controversial topic. We know that if you test positive on a home test, that could be a signal that you're still contagious. And a lot of us have advocated using home tests to sort of right size an isolation period, saying you should be isolated until your test turns negative. Some people may be positive for a long period of time, and it might not reflect their contagiousness. So we really don't know exactly the best way to use this, but you can take a test. The CDC recommendations say you can take a test if you have one on day 5, and if it's positive, continue to isolate. Because the CDC isolation recommendations are at day 5, you can cease isolation and go out with the mask. So I do think that you can use tests to understand what's going on, but sometimes it can be a little bit hard to interpret because people may be positive and they may not be contagious, because when you look at case contact investigations, we've not really seen transmission after day 6 being very, very common. And that's why the CDC shortened isolation guidance. So it's still a little bit controversial and not quite worked out.
Well, thank you so much. I know you have a heart out. You're actually sitting in an exam room, so you're at the hospital. We thank you for taking time, Dr. Adalja, out of your schedule to help us make sense of what's going on with the rising COVID cases. We'll be calling on you again as we continue to track what's happening in the country. And hopefully, as you said, these hospitalizations will remain pretty flat, and we won't see what we saw in the early stages of COVID when hospitals were just overrun with cases. Again, thank you for your time this morning.
Thank you.
All right, my next guest is Emily Gee. Emily is now the Vice President of Health Policy at Center for American Progress. Welcome back, Emily. You heard the conversation I was having with Dr. Adalja, a little confusing, I think, for people about the government's role. The government was very involved early on in the pandemic. Now the CDC has moved from mandates to recommendations. Some people follow the recommendations. As we know, many people don't. I'm just wondering what you all are thinking at the Center for American Progress about how the government should be intervening, if at all, in terms of where we are with COVID and this, what may be this next big wave.
So to reiterate what Dr. Adalja said, we do have tests and treatments and vaccines that we didn't a year or two ago that can prevent illness and disability and even death. But the government is providing things like free COVID tests. We have expanded access to vaccines, but that can only happen as long as the federal government has funding to keep keep vaccine production up, to guarantee our country's spot in line and buying those vaccines, developing new ones for future variants, and mailing tests to homes. And right now, the Biden administration is facing a crunch in its COVID funding. It's asked Congress for $22 billion, which Congress has yet to provide.
So it looks like there's not going to be much intervention. There's not going to be any shutdowns. There's not going to be any mandates. What do you think that's going to mean for the economy? Because people are still calling in sick, taking time off from COVID. So we're still seeing a huge shortage. We go to restaurants, you go to shopping malls, people, businesses are still having a difficult time getting employees back into the workplace. And some of it has to do with this transmissible Omicron.
Mm-hmm. And we saw in the fall that even though Omicron was relatively milder than Delta and others, if you have a lot of people who are contagious and a lot of people are infected, even if it's a small share who end up hospitalized or sadly die from the disease, that does add up. We had 2,500 deaths a day at the peak of the winter surge, and that's something that a country like ours should be able to prevent. And that can only happen as long as we make tests available, make masks available, ensure that it's easy for people to do the right thing for their own health and for their communities.
But Emily, we're not seeing very many policies, even in schools. One of our producers has a high school student or has 2 kids in high school, and there are no masks in her kids' high schools, but she gets regular alerts about the kids being exposed to other students that have tested positive. Like daily, some kid in this high school and high schools all over the country are testing positive for COVID. Should there be more? I guess what I'm asking, and maybe you and the doctor are saying, no, there's not going to be any policy. Everybody's going to have to just figure this out on their own.
I think if you look at the trends of, seeing what's happening in New York, where they're up at a high level of community, what the CDC would call a high level of community risk, or the San Francisco Bay Area, which is also, fairly aggressive in its COVID mitigation measures throughout the pandemic. Both those areas have issued recommendations, but not requirements, as they might have a year or 2 ago. So, given that, I think it remains even more important that the federal, state, and local governments provide things like masks, which I think is most effective. Even one-way mask is important, which is why it's important that we make sure that people have these tools to use.
But Emily, what's the point of having masks if people don't wear them? Like I go out in Los Angeles, nobody's wearing a mask. At the schools that my producer's kids go to, nobody's wearing the mask. So yeah, you can make them available, but people aren't wearing them, and no one is requiring you to wear them. No city, no state, and clearly not the federal government.
So I think the best way to protect ourselves would be if everybody masked. I completely agree, but I think the second best solution here is that if we have individually have access to those tools, at least we can use them to protect our families, or ourselves if we choose. And I think it's getting politically harder for officials to require masking.
So Emily,
that would be
you have a public health crisis, and you just said it's getting politically harder. So this isn't about our health. This isn't about the public health. This is about politics and elections. And that feels really crappy that this major public health crisis has now turned into, a political, really hot potato for folks trying to get elected or folks trying to remain in office.
Oh, I think we're also just seeing fatigue from the general public, right? We are at a high level of spread, but I think there's a lot of fatigue of not just individuals who are wearing masks, but the burden falls upon workers to be the gatekeepers and the monitors in restaurants and airplanes, and that is a tough job.
Yeah, it's a very tough job. What do you guys recommend for those people who live in communities where people are not personally taking on the responsibility of doing anything that looks like mitigation?
So I would recommend that you wear a high quality mask when you're in indoor settings, which is what I do, and I have my family members do. When I'm on public transit, I do that. I think there's risk for doing things like indoor dining that one could choose or to do or not to do to control their level of risk. Rapid testing is also a good way of not only seeing if you are infected, but also preventing infection to others.
So what happens, because we know that Biden is having a very difficult time getting this additional funding. So was there some funding that was approved by both Republicans and Democrats that can be used for COVID mitigation?
So right now, states and local governments still have some money from the American Rescue Plan that they can use for economic recovery, but also for things like, handing out free masks. Here in Washington, D.C., where I live, we have so these great one-stop COVID centers, which I think is a great model where you can walk into a storefront and get the vaccine or a booster if you want. We're still at a place where 30% of the elderly and 50% of adults in total still haven't received their boosters. You can walk in and get masks and tests and instructions. And so there is money to do that kind of thing. But in order to keep producing the vaccine and keep making things like Paxlovid available to revive the program, the uninsured program, which paid for testing and treatment and vaccine-related bills for uninsured patients, Congress needs to provide more funding. Otherwise, we will not have those sorts of resources available for the tail end of this surge or maybe another variant in the future.
Well, that's sobering to say, and somewhat disappointing that, again, as we're hearing about cases rising, that we can't even agree in this country that we need to have more resources allocated for testing and for medication and for vaccines. And we heard the doctor say we probably need a new vaccine, that we need new vaccines to combat the Omicron variant and the other variants that are going to come after Omicron. Thank you, Emily. Enlightening information, always a pleasure to see you, my friend. And we're going to obviously stay on this as we continue to see what happens as these cases rise. Hopefully we won't see that rise in hospitalizations and deaths that you just reminded us of. Such a horrible time in our country. But hopefully this time, as Dr. Adalja told us, it's going to be much different. Thanks again.
Thank
All
you
right,
very
my
much.
next guest is Dr. Monica McLemore. She's a professor at the University of California, San Francisco. She's also the editor-in-chief of Health Equity magazine. Good morning and welcome, Dr. McLemore. Okay, so I'm, as you can probably tell, I'm a little exasperated, maybe a little frustrated, upset. I'm not sure. I have a range of emotions because I feel like we went from a public health crisis that impacted African Americans, Latinos, poor people in the most horrific way possible. And now everybody's just said, hey, y'all on your own, go out there, wear a mask, don't wear a mask, get vaccinated. We don't really care. We ain't shutting down the country. We ain't shutting down businesses, and it's on you.
Yeah.
I mean,
and of course, first of all, thank you for having me. But of course, as the public health nurse, I love dearly and respect your previous guests and our colleagues. But I am going to be the person that states the more controversial view that I do think that we need some public health mitigation strategies, like periodic, lockdowns, like really being able to continue to have individuals not just focus on acute care and, hospitalization. I can't believe our previous guest didn't talk about long COVID or any of the sort of, interim, pieces that are, in my opinion, very specific that we need to talk about. I agree with our physician colleague who started off to say that sort of understanding and living with COVID is something that we need to think about, but to completely focus on the healthcare systems and hospitals, to exclusively focus on, treatment and vaccines continues to mean that we've abandoned, public health mitigation strategies, hand washing, masking, distancing, periodic lockdowns and isolation, paying people to stay home. This notion that it's either or thinking, it's hospitalizations and death or, go on your own, I think really is irresponsible. And I think it admits the defeat of public health and that we are exclusively going to manage this as a, clinical acute care health services, problem. And I reject that.
Yeah, I'm smiling, not because anything you're saying is funny, but because you're just validating that I'm not crazy.
You're not crazy.
Yeah, I'm just sitting here because I'm so frustrated with this notion that it's either or, and that somehow this public health crisis does not involve or require public health intervention. Right. And it must, or else we've all been duped for the last 2 years. And that's not a good feeling.
I think it has implications that are far more profound, not just than infectious disease. I mean, I work in reproductive health rights and justice. So we've known that the public health infrastructure has been, decimated for a very long time. This is just another continuation of that. Oh, we'll kick the can down the road. We won't do public health mitigation strategies because it's always about prevention. And, God forbid you can't measure anything that you prevented, or God forbid you can't make any money off anything that you've already prevented. So you're in a situation where this is just a continuation of what I think is laziness. And I also think it's cowardly. It would take a bold mayor or a bold governor to stand up and say, we are going to limit travel to our geographic location. I exist between the San Francisco Bay Area and Washington State. And I can just tell you, those governors that historically, and those mayors who were very, very courageous in the beginning and really, really wanted to be able to, control community spread, now have nothing to say. They're like, oh no, I'm not going to mandate masks. We're not going to mandate, restrictions on visitation. We're not going to mandate, vaccines. Everything is, whatever you yourself chooses. And I think that is unethical.
Go ahead.
Yeah.
Finish this point.
I think that personally asking citizens, in a global public health pandemic and crisis, to make their own risk calculation around where individual behaviors don't matter, right? This is a collective problem. I can't mask my way out of COVID-19 exposure. And I'm one of the people in the country who have never had COVID. And so for me, I reject the physician's view or viewpoint that he posited that everybody eventually is going to get COVID. So for me, I can take all the, strict COVID protocols that I use in my own life, but that doesn't mean that I'm going to be protected and that I'm not necessarily going to be exposed. And that's where I think the unethical part of this comes in.
Well, I worry about this notion about risk calculation, particularly as it relates to minority, underserved populations. And I think the disproportionate impact of COVID on those communities has been totally erased from the conversation. It's if it did not happen.
Agreed. And this is where the health equity piece is really important. This is why government intervention matters. Because not everybody can afford or have positions where they can work from home. You notice how we don't hear the language of essential workers anymore.
Gone.
Right? There are some people who only because of government intervention will be able to protect themselves and their intergenerational homes that they live in. We're completely leaving everybody on their own with this inherent assumption that we all have access to the same public health mitigation strategies. We don't. We only have access to the same public health mitigation strategies. When we have government, local, state, regional, all, using the power of the federal government to be able to say, we are going to restrict movement. We are going to restrict activities. We are going to mandate masks. We are going to send you tests. Not everybody has equitable access to those things. And so
those essential workers that we talk so much about in the early days of COVID are still working in those grocery stores, still working in those factories, still working in those high contact jobs where now people get to come into the store, breathe on them, come into restaurants and breathe on them and expose them. And we know the fight that many of those workers had, and even just getting time off and getting paid for being off from work. We know the horrific situations that still exist in this country for low wage workers that are predominantly Black, predominantly women, and predominantly people of color. And so to have this conversation be about each and every one of us just being responsible for ourselves obscures that very important conversation that we were having about the conditions of those workers. And that's what really bothers me about this position that our country has now taken, because it yet again marginalizes African Americans. And remember, we just begged African Americans to trust us, right? We just said, trust us, get the vaccine. We're going to do better.
Right.
And guess what we're doing? Not.
And one of the other problems that we have on an acute care or hospitalization focused response to the pandemic is you miss the other social supports that the federal government put into place around COVID. So it wasn't just about masks. It wasn't just about vaccines. It was also about the rent moratorium. Right. It was about allowing people to not have to pay parking fees because they were working from home. Right. There were all these other strategies that were included in the package of when we had lockdown that are necessary in order for people to also not go bankrupt. Right. To also not lose their home because, they can't pay the rent because they can't go into work. Right. Or the paid 2 weeks of leave that people needed. or the hotel rooms that we have for people to quarantine and isolate. It wasn't just about hospitals and vaccines and, access to antivirals. It was also the social supports that folks needed in order to be able to, recover, isolate, and quarantine, from COVID-19.
Well,
So,
Emily was very honest and said that this has become a political issue. We know the midterms are happening as we speak, and it will continue to happen through November. And the Democrats have decided, like the Republicans, that this is an issue that is political poison for them. And it is harmful to candidates to talk about these strategies and talk about these issues that we are having this discussion about. And that's sad. I want to ask you, we had a show about maybe a month ago or so where there was a study out of the University of Georgia. A white professor did a study that showed that white people had decided that COVID was a Black person's or minority or people of color condition, and it didn't concern them. And she said they were able to show that that study, there's a correlation between that thinking and that realization that coincided with the removal of a lot of the elimination, I should say, of a lot of the mitigation strategies. I'm just wondering, did you see that study? And what are your thoughts about that?
Yeah, I was lucky enough to actually be on with you when you had the study authors on.
Okay,
and,
you were here.
Not only did I see that study, but I actually warned people, that had we not worked on science communication and messaging around how we're all in this together, and why a collective strategy was needed, that was going to happen. That was completely predictable, because we've seen historically over time that when we look at and really try to highlight the people who are most burdened and who deal with the poor social determinants of health, white people, because they can check out. And they decide that there is no collective interest in wanting to maintain protections for people if it doesn't personally affect them. Mm-hmm. And so we missed a huge opportunity to really be able to say that, this is not a pandemic of the unvaccinated. This is a pandemic that is really disproportionately, impacting people who already bear a huge burden in the negative social determinants of health. And so we have an opportunity to really, really be able to make sure that all of us can use our empathy, that we can use our power, that we can use our access to resources to ensure that all of us come out of this with minimal exposure, and that we come out, really, really appreciating the notion that collectively we can solve problems. That was the messaging. But we need courage, and we need courageous leaders who are willing to speak that way.
Yeah. What are the three things, and you've identified some, but maybe just help us kind of sum them up, the three things that you think mayors, particularly a mayor like the city of New York, that has said categorically no mask, even though the numbers in New York are rising. There were universities in New York during this period that did go back to mask mandates. So we did see some, institutions like colleges and universities implement them, and some private businesses. What do you think are the three most important things that city government, state government, and even federal government should be doing as they're talking about the rise that has been acknowledged by the Biden administration?
Yeah, I definitely think we should definitely be using high quality KN95 or N95 masks, and those should be available freely for individuals, and that they should be mandated to be worn. I think we need to start to restrict numbers of indoor individuals at events. I think it's time to go back to, indoor restrictions of numbers of individuals. And I know that makes business owners, nervous, but I don't think, we have to shut down it doesn't have to be a universal shutdown. I think knowing, that outdoor venues are more safe than indoor venues, but I do think starting to restrict numbers of individuals indoors. And I do think we need to not only continue with rapid testing, but we also need to keep our testing centers open. I know here in Washington State, some of our major PCR testing centers have shuttered. We have one big one that's remaining in Renton, but I think we still need to have home testing and PCR testing that are working hand in hand and in tandem to continue to be able to suppress community spread. And the fourth thing I will say is we need mass mandates on public transportation. I know I have been flying quite a bit and I have been double masking on planes, and the only people who are masked are myself and the flight attendants. And so I think we really need to come back to, in public spaces, that we need to have some mitigation strategies that are just collectively applied in geographic locations.
Yeah, that seemed like the one strategy that there was just absolutely no reason to terminate that. People had gotten accustomed to it. It wasn't as if people were not going to fly. So you talk about suppressing business. Nobody was going to say, I'm not going from LA to New York because I have to wear a mask. I got to go there for business. I have to go there for pleasure. They were going to, the people were flying. I mean, airports were crowded again. So that one I really didn't understand.
Well, and the truth of the matter for me is, okay, we don't see people complaining about seatbelts. We don't see people complaining about other, mandated public health strategies that we know reduce illness, harm, and death.
Yes, absolutely.
It was
that's always been the response to those people that said somehow these mandates were infringing on their liberties. Well, the reality is the government infringes on our liberties in so many ways each and every day that we have become accustomed to, that we appreciate, like speed limits. I mean, speed limits are a way to prevent car accidents because people die in car accidents. So rather than you being able to travel at 100 miles an hour, guess what? You have to follow the guidelines, 35. In a school district, you have to stop, you have to slow down. So there's so many ways that already happens. Let me ask you about the first responders. I know you work with professionals that work in the healthcare field, and we're not talking a lot about them, but we have seen so many studies of nurses and doctors just being so incredibly burned out and leaving the profession in a lot of cases. What are you hearing and seeing now that this surge is happening again?
I mean, I have to shout out my nursing colleagues and my physician colleagues, pharmacy, social work, dentistry, respiratory therapy. First of all, thank you so much for your service. This is frustrating. This is annoying. This is, unethical. And so we really appreciate you. That said, I have been hearing from trainees. I have been hearing from colleagues. In fact, I'm about to board a plane tomorrow to go to the American College of Nurse Midwives annual meeting in Chicago. We're tired and we feel disrespected. And I think a lot of us are extremely heartbroken, and we are hoping to partner together and strategize with folks to do exactly what you're asking. How can we come back to some sensible public health mitigation strategies that will allow us to keep ourselves and others safe? If I know we're coming up on the summer, but you know what? We do not need another horrendous surge in the fall when everybody has to return indoors and when children have to return to school. So what can we be doing now together, collectively, that will mitigate that problem?
Yeah, and I do want to talk about, you've had your list there, this long COVID. So as I opened the show, I said 2/3 or more than 2/3 of our staff have had COVID, including me. And thankfully, we all had very mild cases. A couple of days of symptoms. We all isolated for 5 days. We followed the CDC guidelines. None of us have had any issues that required us to be hospitalized or any evidence that we have anything beyond what has been described as these very mild cases. But I did worry. I have a son who has autism. I was very, very concerned about spreading it to my son. I have someone that lives with me that is unvaccinated for religious reasons. So I was very concerned about spreading it to her.
Right.
I did think about long COVID. So this notion that we're all going to get it and it's so casual, I reject that. I didn't want to get COVID. I'm absolutely positive we did not. Now, I do take responsibility because I did not follow best practices when I started going back out into crowds. So I don't blame anyone but myself. I take full responsibility for not using those mitigation strategies that I know you should use. But let's talk about the fact that COVID is no joke. And it's not like so casual, like, oh, I got a cold, I blow my nose and, it goes away. So help us understand why people still should not want to get COVID.
Well, just because you didn't die shouldn't be the metrics that we're using in order for people to understand not being exposed, right? This is still a novel coronavirus. So just because people have mild cases, we still don't know what the long-term impacts of that are because we're still studying it. So let's start there. The second piece I would also say is, if we don't want to continue to see emerging variants, then we will have a motivation to suppress community spread. We are lucky right now that our vaccines are still working and can still be tweaked, but viruses mutate over time. That's what they do, right? So we can't think that we're going to vaccine our way out of, whatever, and there's no guarantee that COVID will continue to become milder, right? I mean, as we've seen with Omicron, it can have spike protein mutations that will make it even more virulent or will be able to, circumvent our vaccines. So to me, just because you didn't die shouldn't just be the metric, right? We don't know what the long-term impacts are. And look at the inconvenience, look at the worry, look at the mental health impacts. I mean, you probably were really stressed out. Right.
Well, yeah, and not just so much for myself. I was stressed out for the people that I live with, and feeling responsible. Like, you don't want to get anyone else sick. I'm not in a high risk category. I'm perfectly healthy. But suppose someone is exposed to me is not perfectly healthy. So there are those mental, kind of emotional issues you deal with. And what percentage of people that have COVID do have long COVID? Do we know those percentages?
We don't. There are some estimates based on the clinics that are treating people who make it to the clinic, but that doesn't just mean that that's the long COVID people. So, estimates put it somewhere between 10 and 15%, but that's widely estimated to be an underestimate. Mm-hmm. And because long COVID has such a weird trajectory of what it might present as, it's still not a well understood syndrome. So we have some pieces of it around, fatigue and like extreme disability, but we're just starting to understand the implications of long COVID, right? And its impact on multi-system organ function. For some people, it shows up like, fibromyalgia or other kind of fatiguing kind of syndromes. For some people, it really shows up in the gastrointestinal system. For some people, it really shows up in the neurocognitive system. For some people, it shows up in cardiovascular. So it's so diffuse that we don't even have a good handle on what the whole symptom profile looks like.
Yeah.
That's why avoiding, preventing is still a legitimate goal. That's why I reject this inevitability that we're all going to get it.
Yeah, and I have a guest that's been on several times. She's a woman that has had a fever, literally, like at one point she was well into close to 300 days. Every day of her life, she had a fever that was associated with long COVID. She was going into an actual study group, which is great, with some other people, some scientific research was being done on long COVID. But she said it was a grueling process to even get the government to recognize that there was this whole population of people who had long COVID, needed studying and needed some kind of a more robust response.
Yeah.
So, Dr. McLemore, you're off to this conference, and you said a part of what you all are going to be doing is trying to figure out how you collaborate with other healthcare professionals and other, I would imagine, leaders in the health community to get us back to some mitigation strategy. What do you hope comes out of that? Is there going to be some action plan that, some effort to get to DC to try to talk to legislators? What are you all hoping comes out of this conference?
Well, we're hoping, a couple of things. I mean, number one, we were very glad to see some of the governmental strategies around the baby formula shortage. So there's that, right? I mean, we are also hoping that as we continue to care for childbearing families or pregnant capable people, that there will be some plan specific to the, leaked Supreme Court opinion around Dobbs versus Mississippi. And we are also hoping, we were very glad to model what we hope other conferences and other gatherings will want to be able to do. We had to use an app to upload our vaccine status because proof of vaccination is necessary for in-person participation. There's a virtual participation in the meeting for those people who are either not well enough to travel or those who are not vaccinated. There will be masking during the conference and during the meeting. We are using all the public health strategies to renormalize that for folks.
That's good.
So I'm hoping modeling the behavior in addition to having calls to action, in addition to having a lobby day, which we are also going to be having both virtually and in person, and to work with the community of Chicago to highlight places where communities are pulling together to highlight mutual aid to make sure that we can protect those most at risk, and that's Black and Brown communities.
Well, I am encouraged by that. I'm also encouraged. I found out that I had COVID because I went to a meeting or attempted to go to a meeting at Charles R. Drew University.
Mhm.
At Charles R. Drew University, African American medical school
Yep.
on the West Coast has such robust policies about who enters their campus.
Yeah.
I was going on an outdoor tour. I wasn't even necessarily going inside the building, but they had rapid testing, mandatory rapid testing at the entrance to the campus.
Yep.
And once I was positive, I had to move into my car
Yep.
and wait for a public health nurse to come give me a PCR test and a mask,
Yep.
who then gave me some information and told me bye-bye to
Yep.
leave her campus in a
Yep.
very nice way. She's very nice about it. And then, provided me with lots of other information that was very helpful to me. So I was encouraged by that, they had that protocol in place and they are, as you said, modeling what we should still be doing, particularly in these really high transmissible communities like New York, like Los Angeles County. There's some cities that are hotspots right now.
Bay Area. I mean, when we think about the cruise ships returning to the Bay Area, right? When you start to think about folks moving around, especially where there's been, variability in, vaccine uptake and masking and all of this other stuff, we shouldn't be surprised turning around now where places who originally were very aggressive about public health mitigation strategies are now dealing with surges. This is not rocket science. And so by continuing to normalize, these mitigation strategies, I am hoping that region by region, institution by institution, that people will come back to their senses to recognize that these are the things that we just need to accept as being part of an open society during a global pandemic.
Well said. I hope you'll come back after the conference. Would love to know, what your action items end up being and how successful you are with that legislative day. We know how important that is. And we know there's some folks in Congress who feel exactly the way that you feel and your organization feels. So hopefully you get traction there as well. Thanks so much for joining. I really appreciate your input and, your approach to this and the modeling that you and your association and health professionals like you are doing, because it's so, so important.
Well, thank you for having me and thank you for lifting this topic up.
Great. All right. I want to thank all my guests this morning. This is a very sensitive topic and we've covered it a lot and we're going to keep covering it because we want to help save lives. COVID is no joke. Having had it myself now, my team having had it, we've had a chance to share our experiences. And again, as I said, we've all been very blessed. No one had to be hospitalized. Everyone recovered within a couple of days. People were able to go back out, go back to work, go back to their normal activities. But we're the lucky ones. We should not ever forget that there are, I think we reached that milestone, 1 million people had actually died from COVID. And we know that even though the deaths aren't as high as Emily told us, as they were months ago when 2,500 people a day were dying, there are still people dying every day from COVID. There's still people being hospitalized because of COVID. And I respect our medical professionals. The guests that come onto this show I have a lot of respect for because I wouldn't have them on if I didn't. But I do think that this every man for themselves mentality, this moving away from this being a public health crisis is disturbing. It was disturbing for me when I was calling around for my own case to hear how, in some ways, cavalier the doctors were about my own condition and about how I should treat communicating my COVID to other people. And we know, we've talked about it so much on this show about African Americans, Latinos, the minority communities, how hard our communities were hit by COVID and how difficult it was to get African Americans in particular to move to vaccines because of the historical distrust, because of the historical systemic racism in healthcare delivery that African Americans have experienced. And I worry that after all the work that was done to convince communities of color that this country cared, that their lives mattered, that we were going to do better as a country in terms of our healthcare system, to now just abandon those efforts, those barbershop efforts, those community efforts, those church and faith-based efforts that were so important, for them all to be just gone, poof, no more. I think it's going to really have a negative impact on that great work and on the trust that we started to see in our healthcare system. I don't know. We take 2 steps forward in this country and then we take 12 steps backwards. But it's America. And for some, it's just another day at the office. Be safe out there. Remember, we're all in this together.